Hello, my name is Rose Cano. I'm a cultural mediator at Harborview Medical Center in Seattle, Washington. Specifically, I'm a diabetes navigator within the Community House Calls program, and I work with Spanish-speaking type 2 diabetic patients. In my role over the last 7 years, I've recognized the need for simple messaging of abstract concepts for patients of all backgrounds in order for it to be meaningful. There are Western concepts that, as a system, we may take for granted. These include chronic disease, prevention, primary care. In addition, we have a non-trivial number of illiterate and indigenous language speakers that also have low numeracy and a completely different concept of time and scheduled appointments. The idea behind the steering wheel of self-management is to have a visual tool to be used by providers and patients alike. Providers and educators can teach patients, and patients can teach each other using this tool. The highway as the central metaphor. So in this case, the highway represents your diabetes or your health in general. You can see the highway is endless, representing continuous and chronic, just like your diabetes. And there are many curves and stops along the highway, stops and starts and pitfalls and roadblocks. So I developed a series of images relating to the one central metaphor that seemed to easily illustrate chronic disease as a tangible concept. For many immigrants and refugees, the concept of a long journey or travel is a familiar one. This implies both distance and time in a way that our patients can more easily connect with. The conceptual message, time, something managed over time. So circumstances change in the life of the disease and of the patient. A patient can change countries, change states, they get married, get divorced, have children, they could be deported and come back to the United States, go to immigration jail. All these stressors influence the management of their diabetes. So we come to the steering wheel, the other central metaphor. The idea of the steering wheel is to keep both hands on it. And I point out to patients, the hands are yours. They are not your nurses, your doctors, your nutritionists, your family, your husband, your wife. The idea is to keep both your hands on the steering wheel to help manage your terrain and your own personal highway. So the concept of self, represented by the hands. Perhaps the most basic concept I've shared with patients is the notion of self within a patient-centered care model in a clinical setting. Many of our patients come from countries or health systems that discourage participation, questions, or self-empowerment. They come to clinic for a cure or fix from a specialist, the doctor. They may quickly lose interest and feel like it's not within their right to express misgivings to a doctor once they learn there's no cure for diabetes. So I developed the idea of a steering wheel as a central metaphor for illustrating control over one's chronic disease instead of being a passive recipient of it. Next, we have the steering wheel broken down. The steering wheel has 3 points. Remember, the steering wheel is a tool to keep a handle on your health, and the steering wheel has 3 spokes: food, medication, and exercise. And all 3 are used in combination to help manage your diabetes and keep you on the road to good health or to good self-management. So we can use it with words or without words. And in Spanish, the word manejar means to drive. And it fits in well with our metaphor. So it says down here, manejando el curso de su diabetes, driving the course of your diabetes. And for those who do not read or write, we can have a completely pictorial image of the hands on the steering wheel. And I like to write in the patient's name because the hands are you, and then exercise, medication, and food. So the idea is prevention by using this steering wheel. And sometimes you may have to lean to the right into your medications. And on another point in your life, you lean into your diet and your nutrition. And another point, you may be doing exercise. The way you exercise 10 years ago will be different than how you exercise now. So it's a combination of all 3 things. So putting it all together, we have the central metaphor of the highway with its curves, its stops, and its goes. We have the other central metaphor of the steering wheel with the 2 hands grasping, but with flexibility to be able to manage this over time with the 3 main points of the steering wheel: food, medications, exercise. The steering wheel of self-management driving the course of your diabetes.